I'm Dr. Krishna B. Naidu, trauma and orthopedic consultant specializing in arthroplasty and sports medicine. I work for Columbia Asia Hospital, Sajapur Road. My answer to this question is yes and no. Knee arthroscopy can prevent arthritis, and in certain circumstances, no as well. But once again, these are purely based on individuals. As I previously told you, the treatment is custom made and tailored. For example, if a 30-year-old young male or a young female walks into the clinic complaining of knee pain, who has a trauma at the age of 15, has started developing arthritis, there are various modalities for the treatments of these. Currently what we have is something called as regeneration of the cartilage, and this can be achieved through a knee arthroscopy or even open procedure. So being in short, yes, we can prevent the arthritis, but you cannot prevent the eventuality. If a same 60-year-old patient walks in through the clinic door and complains of knee pain, they have an established knee arthritis. By doing a knee arthroscopy, it can briefly prevent the symptoms, but it would not prevent the eventuality. That is the total knee replacement. It is also based on how significant the progression of the disease is. In short, yes, knee arthroscopy can help, but depending upon what age group you ask this question.